Hi everybody, this is Dr. Ty Vincent, recording a video for low-dose immunotherapy primarily, but this is really for anyone who has corn allergy or who thinks they have corn allergy and is wanting to find out for sure if maybe that is your issue, that you're allergic to corn. For the purposes of doing low-dose immunotherapy with patients, it's really helpful if you can identify a test exposure for corn before we start the process. It allows you to use the same sort of standardized objective test exposure after each LDI dose and be able to determine as much as we can whether the dose had an effect on that reaction or not. I get a fair number of patients who believe they have corn allergy because they've developed all of these very complex recurring symptoms and problems. And when they learn about corn allergy, it can look very similar to what people with corn allergy are experiencing. You can start to cross-react with all other kinds of foods. You can cross-react with chemicals of all sorts. And so people with corn allergy can start to have symptoms that seem like they're all the time and chronic. And they can believe that the symptoms continue to be triggered by corn exposure because corn exposure is just so ubiquitous. Some of those patients, when I work with them and I guide them through this process that I'm going to line out to you here, they find out that they're actually not reacting to corn. They're not allergic to corn. And then that means we have to treat them with something else, some other kind of strategy, some other antigen. They might be reacting to chemicals. They might be reacting to EMF frequencies. They might be reacting to various other foods. They might be reacting to some organism that lives in their body. They might have some kind of autonomic nervous system dysfunction for one reason or another, hormonal abnormalities, toxicity issues like mycotoxins or heavy metals or some other thing. So a lot of these other issues or causative factors can manifest the same kind of symptoms for people. And because of that, it's actually really important to identify whether or not you really do react to corn. And for the purposes of fixing the allergy with me or through some other methodology, identifying exactly what your corn reaction is. So the goal is to find the smallest reactive dose exposure you can, so you don't get too sick or too harmed by your test exposure, because you're going to have to keep repeating that test exposure. And the other goal is so that you have a fairly objective and reliable metric upon which to base your assessment of whether or not each immunotherapy dose had an effect or not. So let's go through that. If you are someone, just before I get into the testing process, if you are someone who seems to react to corn derivatives very significantly, but you don't necessarily have the same kind of reaction to corn itself if you have direct corn, then you're probably reacting to chemicals rather than the corn. So that's one of the things that this process will help you sort through. I made notes this time, which I don't usually do, but I wanted to make sure I didn't mess anything up. This is a common thing I run into. I work with lots of people with corn allergy. There are a lot of them out there in the world, and the numbers are obviously growing. A lot of people have trouble determining whether that's really their problem or not. And so this will hopefully help some people sort this out. If you think you are extremely sensitive, I suggest you begin your exploration process with airborne corn exposure. This is tricky because anything where there's airborne corn exposure, there are also various chemicals involved in the processing of that item, whatever it was, whether it's popcorn or corn chips or some other thing, or somebody's cooking, corn tortillas or something. The food items you're dealing with almost always have various chemical residues in them too, and people can be reactive to those rather than the corn itself. So with airborne exposure, if you think you're that sensitive, one of the things I usually just ask people up front is, can you go to a movie theater? Or can you go into the lobby of a movie theater? The people who I work with who are the most sensitive to corn will pretty routinely say, no, I can't. I can't go in the lobby of a movie theater. I can't go into certain stores or places where they're popping popcorn. I can't have somebody popping popcorn in the microwave of the break room where I work, that kind of thing. You notice a pretty quick reaction building up with that level of exposure. If you are testing airborne exposure, you can start with, popping a bag of popcorn in your kitchen or something. If that doesn't do anything, you can open a bag of corn chips, right in your face. You can get closer and closer and closer to the item until you basically have your face in the bag and see if you have airborne exposure. You get close enough to something like that and you are eventually ingesting some. So if you have to get your face right in the bag, then you might as well move on to the next step. So when you start testing with oral exposure, to corn. I guess before that, I should mention some people have contact sensitivity to corn, which can occur at a sensitivity level sort of between airborne sensitive and ingestion or oral sensitive. You can have people where if they get anything made from corn on their skin even, they'll get like a red spot, itching, a hive. If that's your reaction, that's great. That's a fantastic place to start. It's a very objective test. It's very reproducible. It's something that isn't prone to like a placebo effect. Some people, if they believe so strongly that they're sensitive to something, they just know they're exposing themselves and they can smell it. And then their brain will tell them you're in danger. And people will have a very visceral, very real physical response to just smelling something that they believe is harmful to them. And that really confounds this process. It happens sometimes, and it makes it difficult to tell if that person's truly reactive or not. So if somebody thinks they have that level of reaction, doing a contact test is really, really helpful as a secondary sort of confirmation. Because most of the people, the vast majority of people I've seen who truly have airborne sensitivity will also react on contact with exposure. So you can get some corn meal or some corn starch or some polenta or something and mix it with water, make a little paste, put a little bit on your skin somewhere and see if you get a red itchy spot, a hive, if you will, or something less than that, just some itching and redness. If that happens and it's visible, that's great. That's very objective. You can wash it off with soap and water. The reaction goes away. You don't run the risk of any sort of systemic reaction when that happens for people. And that's incidentally also how we do food exposure testing in patients who have anaphylactic reactions to certain things, nuts or peanuts or shellfish or whatever. We just can use a skin contact test for them as their challenge after each LDI dose, and it works almost every time. So that's a safe thing to do without the systemic consequences. So you start with that. If you pass those initial exposure tests, then you have to do some kind of oral exposure. My suggestion is that you use as clean and pure a corn source as you can find. I think the best thing to use is frozen organic corn kernels because they aren't really treated or sprayed with anything to maintain freshness for travel or sitting on a grocery store shelf for very long. So they seem to be the least polluted. Second, people can use like organic popcorn, but I believe that popcorn kernels are treated with some kind of chemical processing so that they become popcorn, because you can't just microwave regular corn kernels. They don't explode like that. There's something they do to those. And I believe that there's some kind of chemical residue that maybe could confound the process. So frozen organic corn kernels seem to be the ideal thing. Or organic popcorn if you'd rather. And if you start out by just putting a piece in your mouth and chewing it up and then spitting it out. Generally, even if you're very highly sensitive, you'll have limited and short-term symptoms from doing that. If that doesn't cause any reaction, then you can actually, you can chew one up longer, hold it in your mouth longer, spit it out again. You can just kind of gradually prolong and increase the exposure, right? Just logically. If you don't have any oral reactions to these things, then you eventually have to eat one. But just eat one corn kernel, swallow it, see what happens. At this point, it's important to note that everyone has sort of a different individual reaction profile. So if you're used to having symptoms manifest within a few minutes, then you just have to wait that long or maybe a little bit longer. If you are someone who has to actually swallow a piece of corn and then you get symptoms like 3 hours later when it's hit your small intestine downstream somewhere, then you're gonna have to wait that long to see if you have a reaction. And it makes the process take longer, but you have to base this on your own personal experience. People ask me that all the time. Well, how soon should I see a reaction? I'm like, well, that's up to you. That's based on your experience and your immune system's reactivity. It's not the same person to person. So I can't answer that for you, the individual. So experiment with that. Eventually, you may have to eat more and more corn kernels until you eat like a half a cup of corn kernels. And if you still have no reaction even to that, then you're not allergic to corn. You're just really not. There's some other explanation. And it's important to know that. It's important to know that before somebody gets a hold of me and works with me, they can say, instead of being, locked into the belief, hey, I'm allergic to corn, they can say, I am very reactive to something. I don't know what it is. I thought it was corn and I did this experiment you lined out and it's not. So let's explore the other possibilities, because there are numerous other possibilities. And I'm pretty good these days at helping people sort through some of the other things that can cause very similar looking syndromes, trying to figure out, if LDI is appropriate for that person and how to implement it and how to make it successful. If you are allergic to corn, we have an extremely high success rate resolving corn allergy for patients using LDI. low-dose immunotherapy. So that's definitely something worth doing. I'm not even aware of another great option out there for people. Everyone just ends up narrowing their life so dramatically and avoiding corn, and it becomes extremely hard to do because the more you avoid exposure, the more sensitive you tend to become, and people will often over time start to become sensitive to airborne exposure, to chemical derivatives, to other foods, and your world often just shrinks and gets smaller and smaller and smaller. The sooner we get a hold of people to reverse this process and reestablish normal corn tolerance, the better, honestly. And like I said, this works very well. So if you or anybody that you know might have this problem, share this video with people. We are available to help people out with this, and it's extremely rewarding and actually really simple to do once we know what we're dealing with.